Hello everyone, and welcome to the next installment in the Sechrist Veterinary Health webinar series titled Hyperbaric Oxygen Therapy, an Overview. Today we have Adesola Odunayo from the University of Tennesse College of Veterinary Medicine, the Department of Small Animal Clinical Sciences. She's going to talk today about hyperbaric oxygen therapy in the veterinary world by going over some of the concepts and applications along with reviewing some case studies. The goal here is to come away with a better understanding of how hyperbaric oxygen works and how it's utilized to treat most prevalent veterinary cases with tangible results. Just a few housekeeping items before I turn it over. This presentation is eligible for 1 hour of CE credit. I will be sending a thank you email after the webinar to all the attendees with instructions for getting your CE certificate from us, which I'll be sending out shortly. This talk is going to last about an hour in length. Dr. Odunayo is going to talk for about 45 minutes, and after that, she is going to open it up for questions for about 15 minutes. So please wait until she finishes her talk, and then go ahead and type your questions into the chat bar, and we'll make sure that we address all of your questions as they come in. If we do run out of time, we'll make sure to address everybody in an email with some of the questions that weren't answered. So with all that being said, I'd like to go ahead and turn it over to Dr. Odunayo, who's going to take the floor from here. Thank you.
Like Ryan said, today we're going to talk about provide general concepts on hyperbaric oxygen therapy. We're going to talk about what it is, how and why it works. For those of you in the audience who use hyperbaric oxygen therapy, or I will refer to it as HBOT through the course of this presentation, a lot of you are probably pretty familiar with some of the complicated pathophysiology or physiology. I'm actually not going to get into a lot of that. So there are actually a lot of gas laws that I think it's just going to be easier to maybe explain the concept behind them. I'm just going to try to keep it simple, but hopefully also informational. And then we will talk about general common clinical conditions, so how HBOT is utilized in clinical practice. We're going to talk about human patients because we have a lot of evidence from people, but also how we utilize it in veterinary patients. All right, so we will start with the definition. And hyperbaric oxygen therapy is defined as a treatment modality that involves placing a patient in a chamber, so something similar to what we have in this picture. And that patient is provided 100% oxygen. So as a quick reminder, I know we all know this, but animals and people, we usually inspire 21% oxygen. So when we treat with hyperbaric oxygen, we are providing almost 5 times the amount of oxygen at room air, about 100% oxygen. In this chamber. And the other important thing about hyperbaric oxygen treatment, which I will emphasize a couple times over, is that oxygen is delivered in a chamber that has an increased pressure. So we usually think about 1 atmosphere absolute, which is going to be normal at sea level. We want the pressure delivered to that chamber to be higher than that. So some places, depending on what camp you follow, believe that any HBOT therapy has to be at 1.4 or 1.5 ATA or greater for you to be able to say you're providing pressurized or hyperbaric treatment to that patient. So again, in summary, the definition is we have a patient in a chamber, we are providing 100% oxygen, so 5 times what that patient would normally get at room air, and that chamber is pressurized at greater than 1 atmosphere absolute. So we're going to go back and just talk about some of the, again, pathophysiology or principles of hyperbaric oxygen treatment. We're all pretty aware that oxygen is important for everyday activity. One wise person told me a long time ago that everything that dies as a result of poor oxygen delivery. So whether you're thinking about a patient you've had that maybe passed away recently, it doesn't really matter what the underlying condition is, whether they were hit by a car, they had sepsis, pancreatitis. It ultimately comes down to poor oxygen delivery to the heart, which is the reason why the heart would stop. So oxygen is going to be really important. And part of the reason oxygen is important is it is responsible for the daily production of, or minute-to-minute production of ATP by the cell. So in the absence of oxygen, the cell doesn't provide ATP. We all remember that ATP is going to be ultra important for making the cell membrane and ensuring that the cell membrane for that cell is intact. So in the absence of ATP, you get destruction of your cell membrane, ultimately leading to cell death. And if that's significant enough, that will lead to the death of that organ and potentially the death of the patient if you don't intervene. So as a criticalist, I am always, I would say, super obsessed about oxygen delivery in my patients. So not only for those patients who have obvious respiratory difficulty, but patients who have circulation abnormalities, I am usually, focused and paying attention to their vitals to ensure that they don't have any sort of oxygen deficit. And then I'm always thinking about ways to correct any oxygen deficit if needed. So oxygen is going to be really important, and that's going to be the mainstay of talk today. So this is probably the only slide where we're going to delve into a little physiology, but it's pretty straightforward. So oxygen is carried in two forms in the body. It is either going to be bound to hemoglobin, where we have hemoglobin in the red cell. We remember that there are usually 4 binding points. I'm not sure if you guys can see my cursors, but generally the hemoglobin is going to be this big red molecule in the photo, and the oxygen molecules are going to be the green molecule. So in health, usually each hemoglobin molecule binds to 4 different oxygen molecules. And in our patients, as long as the lungs are working well at room air, we would expect that roughly about 97% of the hemoglobin is going to be saturated with oxygen. And that's more than sufficient for most patients. This is what we measure when we utilize an SpO2. So whenever you're checking an SpO2 in your patient, you just want to see what percentage of the hemoglobin is fully saturated with oxygen, and we're going to be pretty satisfied with about 97%. So that's good enough. You're still going to have a couple hemoglobin molecules that are not fully saturated. Maybe they have 3 sites bound to oxygen instead of 4. Generally not a big deal. Now, most of the body's oxygen is going to be carried bound by hemoglobin. So in most cases, it is going to be pretty important that if an end organ needs to get oxygen, there needs to be adequate blood flow. The vessels have to be intact. So if you had a case where, like, a cat has thromboembolic disease, they have a big clot stuck in the aorta, that's going to inhibit the movement of red blood cells and hemoglobin, and that's going to inhibit the delivery of oxygen, because most of the oxygen is going to be carried bound to hemoglobin. Again, in health, when you have roughly about 97% of the hemoglobin fully saturated in oxygen, it doesn't actually make a huge difference by changing that saturation from 97 to 100%. So if I provided supplemental oxygen to my patient, I will get that number up to 100%, but it doesn't really make a huge difference when we come to tissue oxygen delivery for that pet. There's not really a huge difference between 97 and 100. There's a huge difference between an animal that has an SpO2 of 80. Yeah, we definitely want to get that up to the 90s, but generally when they're at 97%, we don't really gain a lot by increasing the amount of hemoglobin that's bound by oxygen. The second form oxygen is bound, which is the form we're most concerned with when we talk about hyperbaric oxygen treatment, will be oxygen that's free in the blood. So the little dots of oxygen that's not bound to hemoglobin. This amount of oxygen can be increased significantly by increase the amount of oxygen delivered to the patient, which is called the FiO2. So again, the FiO2 at room air is about 21%. If we provide supplemental oxygen, we can increase that all the way to 100, depending on what technique we use, which is what we're going to talk about next. So if we increase the FiO2, we will have more oxygen dissolved in blood or dissolved in solution. And the cool thing about the oxygen dissolved in blood is this oxygen is not necessarily dependent on having it put in vessels. If I have that cat that has a big blood clot in the aorta, I can still have this oxygen free in blood, bypass the clot, and just diffuse to the tissue and be able to provide oxygen to the affected tissue. So the two ways I can increase oxygen delivered in blood or dissolved in blood is by increasing the oxygen delivered to that patient, so increasing our FiO2. The other way is by increasing the pressure, which is done by, just give me a minute. It seems like you guys can't really see my slides, so I need to figure out how to increase it. All right, apologize about that. So the two ways we can increase that dissolved oxygen is we can increase the amount of oxygen we provide, increase the supplemental oxygen. And the second way is to increase the pressure. So one of the fancy laws we're not really going to talk about with hyperbaric oxygen treatment just means when we provide higher pressure, that's going to lead to increased solubility of our gases. So we have more oxygen dissolved in the blood, which means there's going to be more oxygen available to diffuse into the surrounding tissue. And this is the main goal of, I guess the concept behind hyperbaric oxygen treatment is we're increasing the oxygen in the bloodstream, and we're doing that by increasing the oxygen provided to the patient, and we're under increased pressure, kind of like we talked about in the definition. All right, so the different ways we can provide conventional oxygen delivery. You guys are all familiar with these. This Dobie, it was a little dog that came with the GDB. And we have a student here holding up a oxygen tube to his face. This is just flow-by oxygen. And this dog, we're going from an FiO2 of about 21% at room air to maybe about 24, 25%. When we do flow-by oxygen, most of the oxygen that is being released from this tube is just going to diffuse out into the room or atmosphere. We're not really going to have a significant increase in the amount of oxygen that a dog is getting or cat is getting. We can improve that by using a mask. So in the picture to your right, this dog has a mask over its muzzle. And the FiO2 using mask oxygen just kind of depends on how tightly fitting that mask is. So we always want to make sure we have enough room for the animal to expel CO2. But if you have a closed, tightly fitted mask, you can get your FiO2 almost as high as 80%, depending on what your flow rate is on your flow meter. So slightly better increase, a lot better increase in oxygen delivery, especially if you have a tight fitting mask. If the mask isn't very tight, your FiO2 may only go up to about 30 or 40%. Other ways is we haven't used this tent in a while, but I actually really like them. We use this for recovering animals when they're waking up from anesthesia, especially brachycephalic dogs. So you just put the tent over them, depending on how small the animal is. It might just go over their head or over the pet's entire body, like we can see in this picture. We always want to make sure there is room for carbon dioxide expel, for the pet to be able to expel carbon dioxide. So this tents usually have multiple holes in them, and then it's usually not a tight fit, so there's generally room for carbon dioxide to be eliminated. But again, depending on your flow rate, we have little oxygen sensors where we can measure the FiO2, and we've definitely gotten as high as about 60, 70%, depending on how high you crank your oxygen. Nasal cannulas are usually easy. They're easy to place. If you have one cannula, you might get 30% oxygen, 30 to 40, depending on your flow rate, but two cannulas can give you about 80 to 90. And then the most effective way we can increase the FiO2 in dogs and cats and people is by intubation. So I hate to use the COVID example, but it's kind of like fresh in all our memories. So in dogs and cats, one of the reasons we intubate them when they have respiratory difficulty is we can provide 100% oxygen through the tube, and especially when they have diseased lungs, we're able to get a higher concentration of oxygen diffuse into the blood and supply all the organs. So intubation is probably going to be the best way we can deliver the highest concentration of oxygen in animals that need it. Obviously, not all our patients need to be intubated to get 100% oxygen. So this next slide just kind of compares the difference between conventional oxygen delivery and hyperbaric oxygen therapy. Again, with hyperbaric oxygen, we're not only providing 100% oxygen, which the only other way we can get that would be in an intubated patient, but we're doing that with increased pressure. So at sea level, with an animal getting about 21% oxygen, we would expect if we got an arterial blood gas that they would have about 80 to 100 millimeters of mercury. That's going to be what the oxygen concentration would be, which is normal. But if we put an animal in a hyperbaric oxygen chamber and we deliver the treatment at 3 atmosphere, dissolved oxygen concentration actually goes up from 100 to about 2,000. So we have 20 times more oxygen in circulation, which shows you that this is a really effective way. This is not as invasive as having to intubate a patient. And then it is actually even more effective than intubating them, where we can get really high concentrations of oxygen circulating in plasma. All right, so the next couple minutes, we're just going to talk about the different kinds of chambers available. We'll start with the one on the left. This is a monoplace chamber, and that's just the chamber that's was designed for human patients, where you just have one patient, generally speaking, in the chamber. As you can see from the picture, the patient is actually able to communicate with the attendant or the medical professional that's monitoring them. We always want to make sure those patients are monitored because, first of all, they're generally sick, so they have some underlying disease, and that's why we put them in the hyperbaric oxygen chamber. We want to make sure we catch them if they have any complications related to their primary illness or the hyperbaric oxygen treatment. One of the advantages of the monoplace chamber is it's small enough that it can be set up in pretty much any practice. So if you're in general practice and you're considering getting a chamber, you don't really have to invest a lot of space. It's not, a really big device. You can definitely find room in your practice for this. In veterinary patients, we usually will just treat one patient at a time, but you can absolutely use it for multiple patients. We had a couple of cats a couple of years ago. We had the wildfires in Gatlinburg, just outside of Knoxville in Tennessee. And we had a lot of cats in our hospital that had suffered bone injuries, especially to their paw pads. And we utilized hyperbaric oxygen treatment for them. And we had more than one cat. Usually we would put them in about 3 or 4 at a time, and that went really well. There have been times where we've had dogs from the same household, especially animals who come in with carbon monoxide toxicity, where they can share the chamber. But generally speaking, we would usually just have one patient at a time. Compared to the multiplace chamber, which is the photo on the right, this is utilized more in human medicine because it's huge. I have another picture of it. So it's going to be really hard. You kind of have to make extra room for this, usually outside of your building. But the advantage is you can have multiple people in at the same time. So instead of having the oxygen run through the entire chamber, like the monoplace chamber, with the multiplace chamber, usually they have to wear a hood, as you can see in the photos, and that delivers the oxygen to the individual patient. But the other nice thing is whoever is monitoring the patient, so the medical professional can be in the chamber with the patient. So we have this critically ill human patient that's lying in a stretcher or in a bed. This attendant can kind of walk with them, mess with their fluids and medications, check their pulse and all of that. They can also intervene quickly if there's a problem. As opposed to the monoplace chamber on the left, a lot of the modern chambers actually have pass-throughs where you can run IV fluid lines and monitoring so that you can also monitor the patient. But if this man, dog, or cat has a complication, let's say they have a seizure in the chamber, you will have to wait to depressurize the chamber before you can get to them. So it still takes a few minutes before you can directly assess your patient. So that's the main difference. In veterinary medicine, we're usually going to be using monoplace or single chambers in practice. So we'll spend a few minutes talking about how each treatment works. Generally, each treatment lasts for about 1 to 2 hours, depending on how long you want to treat them for. On average, the actual treatment is about 45 minutes to 90 minutes. In human patient, which is just what this picture deciphers or demonstrates, some of the things it's done for preparation is to encourage them to yawn or swallow. That's just to get rid of any air in the middle ear, just to prevent middle ear barotrauma, which we'll talk about in the end. Making sure that there's nothing that would incite a fire, like smoking. They usually want them to avoid alcohol and then shower. For veterinary patients, the things we do for preparing them is we want to make sure there's nothing that would also stimulate a spark. So we get rid of anything that has metal in it that might be make it easier for oxygen to ignite. So we make sure there's like no metal ECG pads or anything on the patient. In our institution, we actually cover up our vet wrap, so we will use elastic on just to make sure, again, there's a really low chance of that kind of sparking or igniting. We'll kind of talk about opioids a little in the end, but usually we want to get our patients at least win them off their opioids or have a washout period. We think that, generally speaking, maybe they have a slightly higher risk for having seizures with opioids on board. So we usually kind of prepare them before they go on board, and then they have the compression phase, which is usually just the diving. A lot of those terms are just related to sea diving because one of the earliest use of hyperbaric oxygen treatment was to treat human patients with decompression sickness. So diving just means the chamber is set to go to the pressure you want to treat at. So if you want to do low pressure treatment, that's usually about 1.4 to 1.5 atmosphere. And then most people would treat at about high pressure treatment, which would be about 2 to 2.5. So depending on what kind of pressure you choose, that would take about 5 to 15 minutes. And then the actual treatment, once the chamber gets to your desired pressure, takes anywhere from about 45 to 90 minutes. And then we have about, again, 10 to 20 minutes to allow the chamber to depressurize, which is also called surfacing. And then we usually will do about 1 to 3 treatments per day at the University of Tennessee. And most of our, pretty much all of our patients who get hyperbaric oxygen treatment, they are treated through our physical therapy department. So it's led by Dr. Marty Drum, who is awesome. So I usually just say, hey, I have this patient with pancreatitis. Can you guys do HBOT on them? And they come get them. But generally, we will try to do about 2 treatments a day if possible. Sometimes it's not. And depending on the underlying condition too, you could do more, potentially up to 3. All right, so we're going to talk about how this works. So at the beginning, I talked about how our goal is ultimately to increase the amount of oxygen in the blood. So instead of just having 2 oxygen molecules, as a reminder, most of the oxygen is going to be bound to hemoglobin in the red cell. So instead of just having 2 oxygen molecules dissolved in blood, with hyperbaric oxygen treatment, you have like 200 molecules. So you have a lot more dissolved, which makes it easier for that dissolved oxygen to diffuse into tissue that needs it. So the main mechanism of action for why hyperbaric oxygen therapy works is we want to increase the oxygen tension, and with the increased oxygen tension, we will get things like this make it easier for wounds to heal because we're getting more oxygen delivered to the tissue. So we get angiogenesis, or formation of new blood vessels. We get increased fibroblast replication, increased collagen formation, and enhanced leukocyte function, which all of that contributes to wound healing and fighting infection. It sounds like my slides went back to being small. Is that better? I'm gonna keep talking, but I think
keep talking. It's just your picture of you.
Oh, okay. Sorry.
Yeah.
Well, the other main mechanism of action is the production of free oxygen radicals. So we have lots of free oxygen radicals produced, which leads to the destruction or killing of bacteria, which, as you can see, that can be really helpful in the face of infection, especially chronic infection. And then we also, in the face of high oxygen concentration, it actually leads to vasoconstriction of the arteries of the blood vessels, which is going to help reduce edema. So if you had an animal that had traumatic brain injury, or probably one of my favorite uses would be animals with snake bites. It's super impressive. We'll talk about this here shortly, but they have significant muzzle edema, and we put them in the chamber and they come out and they look almost like a different dog after treatment. So this is the main thing the increased oxygen concentration does. You get super high concentration, which kind of helps with new blood vessels formation, wound healing, killing of bacteria. It also has like anti-inflammatory effect, and then reducing peripheral edema. So this is an old medicine with newish application. We're going to talk next about specific clinical conditions where HBUT can be utilized. But I think it's really cool that the first chamber was built in North America in 1860. It was built in Canada, and then the next one was built here in the States the following year in 1861. And this picture is not a picture of the first chamber, but the picture I have here is a chamber that was built in 1920. I think this is in Kansas City. And this is obviously a multi-place chamber where you can have multiple people in at the same time. Just, I think, really impressive that so much was done. Something that's grand and incredible was done way back then when we had very little technology. And I also actually read about a chamber in, I think it was in Cleveland, Ohio. It was a multi-place chamber, but it was 5 stories tall, and each floor had about 12 different rooms where patients could be treated with hyperbaric oxygen. So even though we're kind of talking about this now, and there's definitely a lot more research, especially in human medicine, into new applications of hyperbaric oxygen, this is something that has been going on for way longer than I think most people would think. Now we'll talk about some of the FDA approved applications. And what this means is the FDA went back and looked at specific diseases where there have been enough studies done or enough evidence to show that hyperbaric oxygen treatment actually makes a difference. So, depending on what camp you follow and who you read, there are societies where the Hyperbaric Medical Society, they have a longer list of indications to utilize this. But I wanted to focus more on FDA approved applications for human patients. So even though I have a picture of a dog, everything on here is specific to people. So diabetic patients, because they have problems with blood flow, which ultimately affects wound healing when they get wounds. Patients with decompressive illness or gas embolism, which can be seen after surgery, carbon monoxide poisoning, osteomyelitis, skin grafts, and wound burns. It is like a standard of care. So if you're a physician and you have a diabetic patient and they have this one, it's completely appropriate to recommend hyperbaric oxygen treatment. The FDA also has a longer list of investigational indications. So these are a list of diseases where there is some evidence that hyperbaric oxygen makes a difference. The evidence may just not be very strong. So instead of maybe having 200 studies, maybe they only have 3 or 4, or maybe some of these are case reports and they're not controlled study. But there's still a long list of things. And one of the other things I want to point out is these are conditions that we see in veterinary patients every day. So even though we don't really have strong guidelines in veterinary patients, a lot of these indications are also similar in our patients. And we do a lot of extrapolation in veterinary medicine. So we're like, well, it works really well for a person. So let's see how it does in dogs and cats. So I'm going to spend just a few minutes quickly talking about 2 indications in human medicine. And I chose this too because these are also conditions we see in veterinary medicine. So the first one is carbon monoxide toxicity or poisoning, which is the leading cause of injury and death when it comes to poisoning in human patients. The reason carbon monoxide is a little bit of pain is because it is a silent killer. So it has no smell, no taste, and it has no color. And it's produced by the incomplete consumption of incomplete combustion of carbon-containing fuel. So these are things that are commonly utilized in the house, like the fireplace or a gas stove or something like that. And for whatever reason, something goes wrong and you get the production of carbon monoxide, and the person or the pet that's in that house doesn't really realize that there's something poisonous, because there's really not a way to know, because it's tasteless and odorless. And the reason carbon monoxide causes a lot of problems, including death, is carbon monoxide has a really high affinity for hemoglobin. So we talked about how hemoglobin binds 4 molecules of oxygen. One of the other things I didn't mention is hemoglobin also binds carbon dioxide. So when the red blood cell goes to the tissue, it drops off oxygen so that the cell can get oxygen, and then it picks up carbon dioxide. But regardless, hemoglobin was primarily created to carry oxygen and carbon dioxide. But then you have carbon monoxide in the mix. And this actually has an affinity that's 200 times higher for hemoglobin than oxygen is. So when you have carbon monoxide in circulation, it displaces any oxygen or carbon dioxide that's bound to the hemoglobin, and it forms carboxyhemoglobin. The really horrible thing about carboxyhemoglobin is it's pretty useless. It doesn't carry any oxygen, so the cells kind of starve for oxygen, and that ultimately leads to clinical signs seen in the death of that patient. So the way we treat carbon monoxide toxicity is to provide supplemental oxygen. So if we can increase the amount of oxygen dissolved in blood, and if we get that concentration really high, super physiologically high, so greater than 100 millimeters of mercury, then that's going to displace the carbon monoxide in circulation and get that patient feeling better. So conventional oxygen works. We can absolutely and should absolutely use a mask, put that animal in a tent, put nasal cannula in, but we know that hyperbaric oxygen works way better than conventional oxygen in hastening the dissolution of carboxyhemoglobin, hastening the dissolution of carbon monoxide from hemoglobin. So it works much faster than conventional oxygen, just meaning that that patient is going to be able to get better quicker. The other cool thing about hyperbaric oxygen treatment is that it's been well documented in human patients that 3 or 4 days after getting carbon monoxide toxicity, they develop this weird neurologic sequelae, which some people actually die from. There has been studies, not all the studies, but there have been enough studies in human patients that have shown that using hyperbaric oxygen treatment actually reduces the incidence of this delayed neurologic sequelae in human patients. I wanted to kind of bring up the study that I found. I think this was published in 2010 in JAHA. And what they reported was 3 chihuahuas who were in a house fire. So they were taken to the hospital for carbon monoxide toxicity. They were treated with conventional oxygen and fluids and just supportive care. And they did really well. You know, they did well for a few days. And then all 3 dogs started having seizures. And despite treating them with anti-seizure medication and supportive care in the hospital, all 3 dogs died. They were able to get necropsies on 2 of the dogs, and they had pretty classic changes in their brain. That's pretty similar to what's seen in people who get this delayed neurologic sequelae. So again, we don't really have any evidence that if we use hyperbaric oxygen therapy for smoke inhalation in dogs and cats, that we would maybe not see this delayed neurologic sequelae, but we can maybe extrapolate until we have enough research and say, this is a reason why I might want to put that smoke inhalation dog or cat in the chamber, even if it looks like they might be responding to conventional oxygen therapy. Maybe there's that added advantage of preventing this like neurologic complications if I put them in the chamber. The other indication, which I'll run through really quickly since we're running out of time, is osteomyelitis in human patient, which is just an infection in the bone. And chronic osteomyelitis is defined as a recurrence of that infection. So that patient is diagnosed with osteomyelitis, they get antibiotics, they take them to surgery, they treat them like they should, but this infection just keeps recurring or doesn't go away. So lots of evidence in human medicine to show that hyperbaric oxygen treatment really does make a difference in outcome for those patients. 14 out of 15 studies showed that there was a positive correlation between the use of hyperbaric oxygen treatment and remission. So the remission rate with hyperbaric oxygen was 89% compared to like 30% with conventional treatment with antibiotics and surgery. So again, this is useful. One of the reasons why the FDA strongly says, yes, this is going to be a standard of care for patients with osteomyelitis. So let's kind of talk about some veterinary applications. Kind of like I referred to at the beginning, we don't really have strong guidelines to say, yes, absolutely, we should use hyperbaric oxygen for this condition and not for this condition. What we have is we have a lot of experience for people who have used hyperbaric oxygen collectively over lots of years, and they publish the results of their they published the experience, I guess I would put it that way, and we can use that as guidelines for our patients until we have enough evidence to say, yes, hyperbaric oxygen works better for this disease than not using it. So this study is a retrospective study. So the authors of the study, which we'll come back to. So what they did was they went back in their records to look at patients who have had hyperbaric oxygen treatment over time. And what they're actually really interested in was complications rate associated with hyperbaric oxygen treatment in dogs and cats. So they had almost 100. They had about 78 dogs and 12 cats. As part of looking at complications, they also listed or outlined the most common things or the reasons why those patients had to go into the chamber. So this is a study out of Australia, so our patient population may be a little different compared to people who live in Europe or people who live in the States. But one of the most common reasons would be neurologic reasons. So animals with extracranial disease, lots of places will put their back dogs in the chamber after back surgery, where they report that they do better. They have subjectively a faster response to getting water and being able to urinate on their own. So there are surgeons and neurologists who absolutely will put their patients in the chamber post-surgery. Another common category would be GI disease. So pancreatitis, which I'm going to talk about, I experienced at the University of Tennessee. Animals who have had gastrointestinal surgery. Immune-mediated disease, if you guys remember, that's actually one of the investigational uses that the FDA outlined. Certainly patients with cardiac disease, patients with wounds and skin flaps, just kind of lots of wide varied reasons why hyperbaric oxygen treatment was utilized in the study in Australia. And this is probably similar to what we utilize it for in our institution in Tennessee. So, I wanted to spend just a few minutes talking about some of the evidence in veterinary medicine. I kind of inferred to at the beginning that there's a lot of evidence in people, enough that the FDA was able to look in the literature and say, yes, there is definitely strong evidence to support that hyperbaric oxygen treatment works for people with diabetic wounds. So we're going to make this like an absolute gold standard for treatment. The challenge in veterinary medicine is we just don't have that. You guys are all intelligent people, so I have laid a good story or claim for why hyperbaric oxygen therapy is awesome, and it is. But I know a lot of you are saying, show me the money, so show me how this has been outlined in the literature. And the challenge, not only with hyperbaric oxygen therapy, but with many things in veterinary medicine, is we are just a little limited as to how much research we have for lots of different reasons, whether it comes to like money to do a study or case numbers, or just finding the right patient population. We just don't really have as much high-level evidence in veterinary medicine. We had quite a few case reports. So like this case report, which looked at a dog that had a gangrene infection and got better after hyperbaric treatment. And I know, some of you might ask, well, how did you know that this dog wouldn't have gotten better anyway? So let's say you have a dog that you've been treating for a wound for 3 weeks in the hospital, getting back treatment, IV antibiotics, bandage changes multiple times a day, and the wound just kind of looks terrible for 2 weeks. And then you decide that, well, on day 14 or day 15, I'm just going to try hyperbaric oxygen treatment and see if it works. So I put the dog in the chamber, and from day 15 and 16, the wound looks incredible. I was able to send the dog home after about 3 or 4 days of hyperbaric oxygen treatment. It seems like a hyperbaric treatment made a positive effect for that patient. But, some of you might be like, well, how do you know that the prior 2 weeks of treatment that you did how do you know that wasn't what set you up for success on day 15? Maybe the dog would have gotten better regardless if you hadn't put it in the hyperbaric chamber. And I think that's one of the big limitations of case reports, which we have quite a few in veterinary medicine, is there's just not really a way that we can say, yeah, absolutely, based on the fact that this dog did better, we can confidently say that the hyperbaric oxygen chamber made a difference. One of the ways that we can maybe better criticize The way we can probably better analyze the importance of hyperbaric oxygen treatment would be to do a case control study. And that involves having two groups of animals. So we'll have a group of animals that are treated with hyperbaric oxygen treatment, and then a control group. Both groups have to be pretty equal, so they should have the same underlying disease. They should roughly be about the same age, have about the same weight. We don't really want a lot of difference in both groups. But then we want to see if we treat them with hyperbaric treatment, does that have a positive effect on the groups that were treated versus a group that wasn't treated. And that was what the study set out to do. So this was a little older in '93. They did not use clinical cases, so they used research cats, and they made a skin flap, exhale flap in the cats, in all 12 cats. They had 12 cats. And then they went ahead and ligated the caudal superficial epigastric artery so that flap had no blood flow, which obviously sounds pretty bad for a flap that's created, because you need blood flow and oxygen for that flap to remain viable. But they ligated the caudal superficial artery in all 12 cats, and they split them into two groups. One group got hyperbaric oxygen treatment for 12 days, and the other group for 14 days, and the other group had no hyperbaric treatment. And the results were, like, for the treated cats, about 83%, or 5 out of 6 cats, had the axial flap survive. So even though they ligated that artery, the flap was still viable at the end of their experimental period, compared to the control cats, where only 3 out of 6 flaps survived. The other 3, or 50%, was not viable. And grossly, to me, this looks like great results, because I can say, yeah, absolutely, it looks like hyperbaric oxygen made a difference in this cats with axial skin flaps. But unfortunately, they had to get statisticians involved. So the statistics people came and they did their stats. And they found that even though it looks really good when you're looking at percentages, there's actually no statistically significant difference. So it actually didn't really matter in these cats whether they got hyperbaric oxygen or did not get hyperbaric oxygen. Like, they would ultimately do about the same. And I think one of the big limitations for this study, which is also a limitation for many studies that we have in veterinary medicine, is the case number. They just had 12 cats. So it's possible if they had more cats, they had 50 or 100, that would reduce the probability of a type 2 error, and they may have been able to find a significant difference. But this is kind of the kind of studies we're looking for, to be able to highlight the importance of hyperbaric oxygen treatment. There just really isn't that many out there. I'm going to skip the next study in the interest of time. And move on to kind of talk about our experience with. The bottom line is we just still need a lot of research, even though I personally feel, and a lot of people personally think that using hyperbaric oxygen makes a positive impact for a group of patients, select group of patients, a carefully selected group of patients. We still need to have evidence to show that, yes, it actually is better than placebo with doing nothing. I'm going to finish up with some of my personal applications, or our personal applications at the University of Tennessee, starting with dogs with pancreatitis. So with pancreatitis, there's certainly evidence in human patients and in animal models that treating them with hyperbaric oxygen actually does make a difference. At our institution, we will generally consider hyperbaric oxygen therapy early in the course of disease. So when that patient is hospitalized, we still want to do everything we would ordinarily do. So if they're dehydrated or hypervolemic, we're going to do fluid therapy. We're going to treat their pain. They're going to get an ultrasound. Usually we're going to put a feeding tube in them and start feeding them. But as soon as things kind of stabilize, we want to get them in the chamber. We're going to provide a washout period for the opioids, which I referred to in the beginning. So we don't want them to be painful. We always will treat their pain. But instead of putting that dog in the chamber an hour or two after getting buprenorphine, we know that buprenorphine is going to be on board for about 6 to 8 hours. So I'm probably going to wait until hour 5 or 6, where I have a much lower concentration of opioids in circulation, and put them in the chamber. And that's going to make it less likely that that pet is going to have a seizure while they're in the chamber. Usually, again, depending on how long they're in the hospital, we're going to do it for about 2 to 4 treatments. And what we subjectively feel is that those dogs and cats, but we just don't often get cats with pancreatitis, but they start eating much faster than if they didn't. So, and we also think that they're more comfortable. So in the ICU, we have really amazing technicians who are very comfortable at assessing pain, and usually they have the liberty to like adjust their pain medication. So like if we have them in a fentanyl CRI, our techs will, they have a range for which they would adjust the pain medications if needed. And many times after hyperbaric oxygen, we feel like they don't really need to be on the high end of their pain meds. Usually they're much more comfortable after treatment. It's also really well tolerated. So it's really rare that my patient population, which again will be critically ill patients, need to be sedated in the chamber. Although if you had a dog who had like a chronic wound and you are treating them every day and it's like a young, healthy dog, sometimes they will require sedation in the chamber. Snake bites, this is also initiated early after stabilizing the patient. We also want to provide a washout period for opioids because typically they are on opioids in the hospital. And again, our subjective assessment is many of those dogs, I think I kind of talked about this in the beginning, but their swelling it's pretty impressive how much less swollen they are when they come out of the chamber. And they're also more comfortable, and I think it also shortens the stay in the hospital. So this is a picture of a dog who was bitten in between his eyes. You can see he has some necrosis, and yeah, they just kind of lie in the chamber, and usually you don't really need much until their treatment is over. So we are currently doing a study that is generously supported by Sechrist in association with the private practice in Oklahoma City, Neal Veterinary Hospital. We're really, really excited about this collaboration because they see way more snake bite patients than we do. But more importantly, they're just a really awesome group. So we want to try to see if we can contribute positively to the body of evidence surrounding the use of hyperbaric oxygen treatment in dogs that have been bitten by snakes. So the way we have the study set up is we have, it's going to be a blinded randomized control study. So meaning we're going to have a group of dogs who were treated with hyperbaric oxygen and a group of dogs who were not. The investigators, so the doctors on the case, are not going to be aware of who got treated and who did not. This is just to remove any bias. Because if I know that this dog definitely got hyperbaric oxygen treatment, then subconsciously I might say, yeah, this absolutely looks better. So we're going to take that away by blinding the people who are going to be assessing the patients, so the doctors, but also our technicians and interns helping us with the study. A physical therapy group, which pretty much run a hyperbaric oxygen unit, they would know. So if a dog is not getting hyperbaric oxygen, they still sit in the chamber. They just don't turn the chamber on. They just kind of sit there for the same amount of time, an hour or so, just to keep everything even. And if they're getting hyperbaric oxygen treatment, then they run through the spill. So we're going to do 2 sessions. They have to be at least 4 to 6 hours apart, but it could be longer. Again, the control group gets no hyperbaric oxygen treatment. And then we're going to try to assess some things. Some of it will be subjective, but we also put some objective assessment. So we're actually going to measure the muzzle of the extremity before and after treatment to see if the swelling actually objectively, if there's a difference in the size, because I could say, yeah, this absolutely looks better. And then you measure it and it's exactly the same thing. We're going to utilize snake bite severity score. We're going to look at their vital signs. We're also going to assess their pain before and after treatment, just to see if it makes a huge difference. So far, we have about 13 cases we've enrolled, and we are excited. Snake season is just about starting, so we're excited to kind of see what we find. Other things that I have used in collectively, we have utilized hyperbaric oxygen treatment for in our hospital. Definitely lots of wounds. I talked about the cats that were in the Gatling bug fire. They went into the chamber twice a day for a long time. But we also use it for chronic wounds. So our surgery service would put dogs with like non-healing wounds or cats with non-healing wounds in the chamber. We've had a few cats with inflammatory thromboembolic disease with the owners. I mean, the unfortunate thing about this disease is many people just euthanize their cats when they come in, but cases where the owners have chosen to try, we've definitely put them in the chamber. We had a cat who ultimately got amputated, but that was different. It was a trauma case, but he had a clot to one of his front limbs. And Dr. Cool, our ECC resident, actually looked this up in people, and utilizing hyperbaric oxygen was actually happens pretty often in human patients with thromboembolic disease. We've had cases of traumatic brain injury. Probably one of my favorite cases is a dog that had inflammatory bowel disease. It's a case managed by one of our internists, and unfortunately, he ultimately passed away from the disease because he had a really severe form, and he was only 2. But towards the end, when he just had a lot of peripheral edema because of his low albumin, he would go in the chamber and he would feel better. I mean, I feel that it bought him some time. I bought him more time with his family. He would feel better. He would be more likely to eat. So that was really cool seeing that, even though ultimately, we couldn't kind of save him from that terrible disease. And then we have used it with carbon monoxide toxicity. And we don't really use it a ton with neuro cases like back dogs, but there's certainly practices that utilize hyperbaric oxygen treatment post-op for their back dogs. So finishing up, we'll just kind of talk about some of the adverse effects we see. Generally, this is a pretty safe modality. Common adverse effects in people will be things like seizures. The rate of seizures in people is actually really low. It's 0.03%, so not very common, but seizures kind of manifest as a form of oxygen toxicity. Just because of the injury to the neurologic tissues. Usually, we don't really get long-term seizures once you get them out of the chamber. It's not like they're going to continue to have seizures. And the recommendation then is just to try a lower pressure if you have to treat that patient again, or potentially maybe a lower oxygen concentration. Other complications with pulmonary barotrauma, we can see oxygen toxicity, especially in patients who are on oxygen prior to getting into the chamber. The most common complication that's kind of talked about in people is going to be that reversible middle air barotrauma. It's going to be similar to us getting on a plane. And I am ashamed to say that I have cried a few times just because of the increased pressure in my ears. And it's pretty similar to being in the chamber. So if there's any like gas bubble in the air that collapses during the treatment, but it re-expands and can get bigger after the treatment and be really uncomfortable. So this picture that I have here, this is just from a study. It's the same study I talked about earlier, the group of people who wanted to look into the complications or adverse effects of hyperbaric oxygen treatment in dogs and cats. Again, it was about 78 dogs and 12 cats. They only had 76 complications, and they're all minor complications. So in that study, none of those patients had a seizure. But most of the complications, so the head shaking, the panting, swallowing, air flake vocalization, yawning, like almost all of those complications were thought to be associated with this reversible middle air trauma, barotrauma, where the dogs are just uncomfortable. So they demonstrated that by shaking their head or panting or vocalizing. And all of this was, again, just transient. All of those dogs went back to being normal a couple hours after their treatment. And then lastly, ignition of pressurized oxygen, and that's kind of makes the news whenever it happens. Thankfully, it's rare that it happens, and this is something that's absolutely prevented by just good training. So when Sechrist installed our machines, they did a great job of coming on and telling us what we needed to do to make sure we're safe and we keep everybody safe. So that's, again, really low, but it is a potential adverse effect that can happen. Some contraindications. So the main thing is I just don't want to put any patient in there that I would need to get to quickly. So if I have a patient that's having multiple seizures that I haven't been able to control, then I don't want to put them in the chamber where I'm not going to be able to reach them if they're like, flailing and they could potentially hurt themselves. If I have a critically ill patient but they're unstable and things can change quickly, drastically, then I don't want to put them in the chamber. We usually want to avoid any patient with pneumothorax because pneumothoraxes can get worse. They can develop tension pneumothorax. It's kind of the same concept with that middle air barotrauma, where if there's any air in the chest, it can possibly re-expand at the end of a treatment, and that could potentially be really bad for that patient. So like patients with trauma, we want to make sure we get chest x-rays, and if they have any evidence of pneumothorax, we want to wait until that's fully resolved. In human patients, they actually will be really cautious if they have any evidence of a bleb or a bulla on their chest x-rays. And then any patient that has a high risk for aspiration pneumonia, we just don't want them to be in a place where we can reach them if they vomit or have any other complications. So in conclusion, I apologize for going over, but hyperbaric oxygen therapy is really safe and well tolerated in our patient population. So again, most of our patients will not even need to be sedated. They just sit in the chamber. It's easy to utilize in practice. With the monoplace chambers, they're not very big. So there are many private practitioners who utilize or have a chamber in practice and utilize it well. There are lots of potential areas for use in veterinary medicine. We still have a lot to do in terms of research, just to be able to, very confidently say that not just subjectively, but objectively, this actually makes a huge difference for our patients. So as a whole, we need to walk, veterinary professionals need to walk on research, but specifically, I think subjectively appears to make a difference in specific clinical conditions. And it is a great argument to my practice. I love having it available and having the opportunity to treat patients with it. So this is just a picture of our unit. Like I said, not very big and really easy to utilize. That is all I have. If anybody has any questions.
Yeah, we're going to open it up for questions. So if you guys have any questions, feel free to pop them into the chat bar and we'll respond back and answer any questions you guys might have.
Looks like there are a couple people typing, so I will wait. Thanks, Dr. Kimball. So her question is, since HBUT increases blood flow to the tissues, is it contraindicated to give it to patients with cancer? So that's a great question. So the question is related to the fact that we know that increasing blood flow or having high concentrations of blood vessels can actually be a means to kind of feed the cancer and make neoplastic cells grow. In human patients, there are actually some neoplasms where hyperbaric oxygen is beneficial for. So probably because of the fact that it may help with inflammation, can it help with some of the edema, helps with pain. Again, it's not really like an FDA approved use. So neoplasia isn't on one of those lists, but again, subjectively, for some neoplasms or based on case studies, those cancer patients have responded positively in the short term to hyperbaric oxygen treatment. So I think it just depends on what kind of neoplasm it is. Ultimately, I don't really know. I don't remember seeing anything specific about specific cancers in veterinary medicine, but I think there is a role depending on the cancer and what you're trying to do. Let's see. The next question is Listener George. Have you used any other brand of HBUT mission? Are they all pretty similar to use? Yeah, we had another brand, which I apologize, I do not know the name, before we got our Sechrist in, and that was also pretty easy to use. This new mission we have has some added advantages than the other one, the Sechrist mission we have, but it was pretty easy to use and it was smaller. So, you know, if you are potentially looking for, like if you had a really small space to utilize this in practice, then I would say that would be an advantage of using the other brand. I sincerely apologize. But yeah, it was pretty easy to use. We didn't really have any complications with that. And then Dr. McManaman asked if there's any data on HBUT intracranial ischemia. Yeah, there's actually a lot of case reports and a few controlled studies, but not a lot in human medicine that have looked at utilizing hyperbaric oxygen therapy with patients with intracranial ischemia. And it tends to be like a positive trend. I think there was a control study that didn't really show a difference, and then maybe there was one or two that showed that there was a difference. Not in veterinary medicine. I know that there was a proceeding that I wasn't able to find because it was many years ago, but it was Dr. Crow, who is like the grandfather of hyperbaric oxygen treatment, where he just had a case series of dogs and cats with neurologic signs. So there wasn't really like a specific diagnosis as to whether they had ischemia or not, where they utilized hyperbaric oxygen therapy, and overall it was safe and it seemed to be, again, subjectively beneficial. It wasn't a case-controlled study, but certainly it seemed to be positive or helpful. So I think because the risks are pretty minimal, I would be inclined to try it if you thought you had a patient that had intracranial ischemia. Yes, Leslie, Ms. Werzak said the Sechrist unit does allow greater visibility, which is true. Compared to our old unit, we just couldn't see them quite as well because it wasn't quite as open. And then we had a question about placing more than one animal in the chamber. Yeah, so with the Sechrist unit, because it is so big, we have absolutely placed multiple animals in the chamber. We don't do it often because I think you kind of have to, well, first of all, it's not very often that you have more than one patient in the hospital that needs it at a time. But secondly, you need to make sure that they would get along. So if you have like 2 random dogs, even if you have them separated and they're not very happy to be in there, things may go bad really quickly. With cats, we usually just put them in their carriers and leave them in there, and they seem to do really well. So one can absolutely utilize the chamber. Depending on the size of your chamber, you can absolutely utilize it multiple animals at the same time. I apologize, I'm trying to read and talk at the same time. So there's a question about what about any use with radiation treatment, since radiation treatment creates radicals and having the extra oxygen in blood could mean extra radical produce. Does the increased oxygen content in the blood move for a couple hours and it would take to move? Oh, okay. So I think the question is, would you still have a high concentration of oxygen in the blood after treatment from the time it takes you to move the patient from HBUT to radiation therapy to set up the unit? Absolutely. So there have been studies that have shown that actually for up to 3 days after getting HBUT, the PaO2 in the blood is much higher than, again, normal will be 80 to 100, but these patients, human patients, have been able to sustain higher PaO2 concentrations even days after having HBUT treatment. Now that I'm saying this aloud, this would actually be a relatively easy study to do in veterinary patients. It's just put them in the chamber and then get blood gases after treatment, and then have a time interval. But most certainly in people, it has been shown that the oxygen concentration stays in place for sometimes up to a couple of days. I mean, that probably won't be true for every patient, but I think if you're thinking about time to get from HBUT to radiation therapy, you should still have a positive effect. I mean, that should hopefully take a couple of minutes, but even if it took a few hours, you should still have a higher concentration of oxygen. And then HBUT treatment's different for patients with AT that have concurrent congestive heart failure. So we kind of talked about how arterial thromboembolic disease in cats would be, if you have a client who is willing to try, I would absolutely put them in the chamber. I think my concern would be if they had concurrent congestive heart failure, those patients are a little more critical. I might be, depending on what the cat looks like. So if the cat is maybe just a little tachypnic and they're going to be getting oxygen anyways, then absolutely I will put them in the chamber, because ultimately we're just going to increase the diffusion of oxygen through those edema-filled lungs into the bloodstream, and that would at least help that cat feel better for a little bit. But if I am worried that the cat was unstable, maybe the cat might need to be intubated because they're just so tachypnic, then I would probably wait until they're a little more stable before I put them in the chamber. So I haven't had to do that yet, but that would be my assessment. All right, well, thank you. You guys have been an awesome group. I really appreciate you coming. And if there are any more questions, I believe Brian is going to get them to me and I can email you guys back with the answer.
Absolutely.
Thank you very much.
All right, thanks, everybody.